Nosodes have been around for a long time. Nosodes are like actual micro vaccines. Nosodes were around, I think, 800 BC. The Chinese used smallpox infected sputum and inhaled it to vaccinate themselves against smallpox. So nosodes are basically a micro vaccine. It's a micro dose of an actual disease that you take to treat and also to prevent certain diseases. So they've been around. It was around in the 17 or 1800s. A veterinarian used distemper, dogs with distemper, and used their sputum to and gave it, basically gave it back to dogs in a diluted form to, prevent them from getting the disease. It's been used, and I mean, there's literature on it too. It's just a very well-kept secret. It's homeopathy, which, a lot of people think is quackery, which it's not. It's been around for, 250 years. Homeopathy. Wow. Yeah. And so using the actual, it's like I said, like a vaccine, right? You take the disease,
right,
attenuate it, and give it back to.
Isn't that what vaccines do too?
Except, yes, kind of like that. But of course, there's other stuff in there.
There's all the other stuff in it.
There's all the other stuff in it.
And it needs live tissue in there in order to activate.
And sometimes they'll actually inject you with a virus, like the, canary pox virus is used as a vector to carry the DNA of the viral particles. So you're injecting viruses.
Yes.
So nosodes, even during early stages of AIDS, they used nosodes in patients that were not on the, was it AZT yet?
Yes.
And they used nosodes to treat these AIDS patients, and their white blood cell counts came up.
Yes, which made their bodies stronger and able to fight it. Yeah.
So
and then they gave them AZT to kill them.
Right. Exactly.
Because they admitted later it was killing them.
So it's an immunostimulant. It stimulates your immune system to fight off the disease.
Right.
Naturally.
Okay, so but what was the other evidence you saw of what you think is related to vaccines?
So, I remember when we were doing 3 vaccines on puppies. It was, when I came out of school, it was like you do a series of 3. Shortly after I graduated, all of a sudden it was like, no, we have to do a series of 4 vaccines. It's better for the immune system. So we did that. I was seeing a lot, and we already knew then there were vaccine reactions, adverse events, and back then we reported them. And also we knew, and people my generation will remember, don't split, you should split vaccines on little white dogs. They're hypersensitive. They tend to have vaccine reactions, Cocker Spaniels and autoimmune diseases. We knew this 30 years ago. So you never vaccinate a dog that is sick. You never vaccinate a dog that has an infection. You shouldn't vaccinate a dog with an ear infection or with a skin infection. All that went away. It's like that's immunology 101, right? When you're sick, you should not receive a vaccine. But yet it's widely practiced. Oh, I'm here right now. Well, he has got an ear infection, but he's due for his vaccine, so let's just do it all.
Yeah.
It's going to create the perfect storm in about 4 weeks, and not just one vaccine. We're using, little dogs like Honey, getting 4 vaccines all at once.
Honey?
I know, it's terrible.
Poor Honey, sorry, baby.
Things have changed over the last 30 years that I saw. And I think COVID, like Dr. Tenpenny said, was a gift because it opened a lot of people's eyes. And then, even though I was still vaccinating as a regular vet, I was splitting vaccines for the last 30 years. I've been splitting vaccines. I always thought that it's way too much to put into a little body, or not giving too many vaccines, obviously. But COVID changed my opinion of a lot of stuff too. So, you start questioning things.
Yes.
What they've been teaching us and feeding us in school. And I think it's just getting worse.
So what are the effects of the vaccines? What are the things you observed clinically that made you concerned?
Immediate vaccine reactions are usually, it can be anaphylaxis, can be hives, swelling, vomiting, diarrhea. It's usually the long-term effect, about 3 to 4 weeks later, autoimmune diseases, autoimmune hemolytic anemia. I'm treating a dog right now that had a rabies vaccine, and 2 weeks later she had encephalitis and seizures, and just horrible. She was on steroids for 4 months on high doses, and the owner thought she was going to have to euthanize her. So we're supporting her with alternative medicine, and we've weaned her off steroids. And yeah, I know. So it's not a coincidence. I mean, anything ranging from local reactions to severe autoimmune. I'm seeing young dogs with cancer. So the question of turbo cancer in animals, why all these young dogs with cancer? And they're all, of course, I can't prove it, but they're all vaccinated.
Yeah, I was going to say they the first thing, the counter to what you're saying will be,
Yes.
well, how do you know that was caused by the vaccine? That's not the vaccine.
No.
That would be one counter.
Right.
And then the other counter would be, well, you're putting animals and people at risk if you don't vaccinate.
Yeah, I don't know that the incidence of rabies is that high, And then again, lifestyle. What lifestyle is your dog leading? Is this a 3-pound Yorkie that never leaves the house?
Right.
How is this dog gonna, be a risk to anyone?
Well, I guess if somebody has kids and they're running, the kid gets bitten. I mean, I don't know.
Well, if the dog bites a child, even if the dog's had no exposure to rabies and is an indoor dog only, and there's no way, the state gets involved.
Well, in Texas, I mean, you have to quarantine your dog, which after 2 weeks they know there's no rabies. But
Yeah.
And then if you're not up to date on your
Right.
vaccinations, which I love because all of our dogs have been vaccinated repeatedly except the puppies. And now I'm having people say, we want puppies, but not if they've been vaccinated. And other people are saying, I spoke to ranchers over the weekend and the last few days, and they're all saying they don't vaccinate their cattle anymore, and their goats and their sheep and everything. And they say that their animals have never been healthier.
Yeah. Well, and you can create natural immunity in all of them, right?
Right.
So you can create natural immunity with the nosodes. So you don't have to just use nosodes to treat them, but you can create natural immunity for rabies, for example.
Yes.
An easy way, easy, of course people are going to probably dispute this, but you can use rabies nosodes and then take your dog. You can't give nosodes and keep your dog in a bubble or your cat, right? So if your dog is not going to go out and be exposed to other dogs, you're not going to create immunity. You have to have that exposure to the vaccinated or, dog parks, whatever. So you can actually, and I've seen it. I've seen positive titers in dogs that are completely unvaccinated and have only taken nosodes.
I see. So, and what do you mean by a titer? That's like a marker in the blood.
Yes, it's antibodies to parvo or distemper or rabies.
And that will tell you that the dog or the animal is immune, right? Is protected. Yeah. And can you get that after one, like if your animal's had one rabies vaccine, is that enough?
Oftentimes, yes. But nobody will recognize that. It's not recognized by the state or by the government as a valid form of coverage, right? So they still want to see the vaccine. Even if you have titers that are positive and say you have enough immunity, they won't recognize it. So there's some people working on changing, that's state by state, by the way, too.
Yeah, and is that a money thing?
Oh, I'm sure.
And a liability thing, right?
I think it's a money thing. I think it's my personal opinion is that it's the vaccine lobby, telling legislators, no, we need to have annual or whatever, every 3 years. Is it annual in Texas?
I think so, yeah.
Well, it's every 3 years in Tennessee.
So whatever the rule is, repeatedly vaccinating your animal for something they're probably already immune to is pointless.
Yes.
And how much money do vets make out of this?
On vaccines? Well, it's definitely going to generate income. It's, getting them in every year for the vaccines.
I mean, is it like pediatric vaccine? vaccines where it makes up, people say between 50 and 70, as much as 70% of a pediatrician's revenue comes from the vaccine schedule?
I'm not, you know what? I don't know how much it's not, but it is a good revenue stream.
It's a sizable income.
Yeah.